At this point, we really do not exactly know when treatment with multikinase inhibitors should start. We have very rough guidelines that tell you that a patient should be progressive, that tumor volume should be considerable, and that the patient should be reactive iodine resistant. But we do not know what rate of progression is required for optimal treatment. We do not know an exact cutoff of tumor volume. So there is a lot we do not know at this moment.
When people ask me the question, when should we start with multikinase inhibitor therapy, as a purist, I should say that we have the data from the Decision study or from the SELECT study that says you should start it when patients have no longer benefit from radioactive iodine because it's no longer avid or is growing in spite of iodine. They have progression of their disease, and they have detectable disease based on RECIST criteria, which means that they have at least one nodule that's a centimeter. So that was the eligibility criteria for the trials, and I'd say that's the bare minimum of what we would require for starting with kinase inhibitors. But there's a very large, broad range of how people will then use that information. Will they start immediately at that point, or will they think that it's better to hold off for a while and then start later? And we really didn't have the answer to that question, and there was concern that we didn't want to give people toxicity when they had a very low burden of disease. The growth rate was very slow, and we knew they were going to be asymptomatic for quite a while. Why give them the side effects of the treatment if they weren't going to even have side effects from the disease, so to speak? So because of that, we wanted to answer that question. So the design of the RIFTOS study asked that question. If we have people that meet that criteria, we're now going to look at the difference between the people that are started initially right away on therapy versus people who are actually held off for a while. And then sort of see if there's any difference in the outcome. Do they do better or worse? Do they live longer or not live longer? Or what are the differences between those two groups? To try to really get at that question of should we be treating people right away or should we wait a little bit longer?
The RIFTOS trial has been designed to answer the question what would be the optimal time point to initiate tyrosine kinase inhibitor treatment. And the RIFTOS trial is a non-interventional international trial, and the most important endpoint is time to symptomatic progression. And two groups of patients are being compared. Both groups contain asymptomatic patients. One group contains patients who already have been treated with tyrosine kinase inhibitors at baseline, and the other group contains patients without treatment of tyrosine kinase inhibitors. The trial is very important because at this moment there is not a clear guideline that tells you what would be the optimal time point of starting systemic therapy. Of course, in the indications it's set out that patients should be progressive and that there should be radioactive iodine resistance. But this includes a whole spectrum of conditions, and what we see is that many colleagues tend to interpret those frames differently. So we hope to learn from this trial what would be the optimal time point to start. And in this respect, the trial will be practice changing because at this moment we do not have a clear guidance on how to deal with this question.
The results of the RIFTOS trial, which is aimed to determine whether or not starting early or starting late is optimal for the patient, could be practice changing depending on what the results of the trial are and what you already do. So, it may turn out that it says you really should start treating earlier than later. If it says that, then of course the people who've been holding off until symptoms develop or for longer periods of time will then probably change their practice based on this. But the interesting thing is it will be practice changing because there's such a large variety right now in what people do that I think it will probably help guide people into more of a consistent approach to when therapy should be started with the kinase inhibitors.
The importance of the RIFTOS trial for community oncologists is that it will help them to determine what would be the optimal time point of initiating systemic therapy in thyroid cancer patients. But having said that, I really believe that treatment of thyroid cancer patients should take place in centers that are specialized in this treatment, because it's a low prevalent disease and we really need multidisciplinary management of those patients, and all treatment decisions in our institute are being made in a multidisciplinary team. So for community oncologists, I think it's very important that they are part of those multidisciplinary structures. And in that setting, the RIFTOS trial will help them to make decisions on initiation of kinase inhibitor treatment.